Good afternoon, and thank you all for being here today on Tuesday afternoon. Last week, we had an opportunity to update the people of Mississippi, and I said very clearly that I believe that vaccine distribution was going too slowly and that we were going to address it. Today, I'm happy to come before you and share some of the progress that we've made. We obviously have more work to do, but we are quickly improving. To date, we have done 62,744 vaccinations. That's over the last 4 weeks. You may recall a week ago I said we had done just over 20,000. So we more than doubled total output last week alone. Those were focused primarily on healthcare workers, long-term care residents, and Mississippians over the age of 75. The total number represents about 2% of our total population. Just to put this in perspective, the first 3 weeks, we had done a little less than 25,000, approximately 7,500 per week. We did 7,500 shots that were reported yesterday. We doubled the total number of shots last week compared to the 3 previous weeks, and we believe we have a plan that should get us very near doubling yet again in week 5 what we have done in week 4. We now, because of that plan, have the ability to do approximately 30,000 per week through our state-operated drive-through centers alone. That does not include the other 3 avenues of distribution, which include the private clinic distribution plan, the nursing home distribution plan, which is really the federal pharmacy program, which is being run by CVS and Walgreens, and then, of course, those doses that are still standing at our hospitals. We believe that we are headed in the right direction, and I was happy to see that just yesterday we actually, on a per capita basis, exceeded our friends and neighbors in both Alabama and Arkansas within the last week. But we know we're only going to keep improving. It has to continue to get better. That is our mission now. One important announcement that is going to hopefully unlock quite a bit of potential. Starting today, we will be offering the vaccine to anyone who is over the age of 65 and anyone who has a pre-existing condition that makes them more vulnerable to the virus. That's exactly the kind of expansion that we've been pushing for and that we want to see continue. We're working ahead of schedule, but we're never working quickly enough. So, if you're over the age of 65, there are appointments available later this week and into next week. All you must do is call the call center at 1-877-978-6453. If you are more technologically savvy, we would love for you instead to go to the website COVID vaccine, covidvaccine.umc.edu. That is where you can make an appointment online. We know that they're updating the form on the website as we speak. So if it's not already changed, although I believe it is, but if it's not already changed to allow 65 or those with pre-existing conditions, then check back very soon because it will be open sooner rather than later. I also want to point out and just be very clear to our emergency first responders, to our police officers, to our firefighters, and to our teachers, you're on deck. The next time we have an update, I expect that it will be to announce that the vaccine will become available to you. So please stay tuned. And if you are currently in one of those professions and you have a pre-existing condition, or if you're over the age of 65, do not feel the need to wait. Get an appointment today. Before we move on, I do want to roll through some of the metrics that we're tracking for the sake of transparency, so that you can understand what's been happening and where we're going. First of all, as I mentioned earlier, we have 62,744 reported shots in arms as of today. Of those, 57,014 of them are the first dose. 5,730 Mississippians have now received both their first dose and their booster dose, or their second dose, which makes them fully vaccinated. Total number of vaccinations reported by week, as I mentioned earlier, 32,173 in week 4. At this time, we have had approximately 7,500, just slightly shy of that, administered in the last 24 hours. We have had 62,744, as I mentioned earlier, administered to date. If you look at the total number of vaccines that are coming before us, I would anticipate that we will continue to get more and more in the short run. It appears, as we talked a little bit about last week, that the administration is going to go ahead and send us the second doses that they were holding back. And so that's the good news. We should get additional supply of vaccines soon. But I must point out, and I'm going to say this a lot today, it has been made clear that going forward, probably as soon as a week or two from now, it is likely that the federal government is going to start reallocating and redistributing dependent upon one's ability to actually get shots in arms. And by the way, I don't blame them. That's why it is so important that we continue to work to get these vaccines out. We have too many vaccines that have been distributed that are not yet in arms. And for those entities where that is the case, we have and we will continue to reduce the allocation to those who are not fulfilling the mission. Our two biggest vulnerabilities right now with respect to the slow rollout of the vaccines are in our long-term care facilities. That is the federal pharmacy program, as I've mentioned before. And we spent a good bit of time over the last 24 hours talking about what we can do to increase that from the outside or to simply take it over. The second vulnerability is doses standing unused or unreported at our hospitals. They've been given an allocation, and in some instances, they're not using them. And that has to stop. It's why we've largely supplanted them with state-run drive-through clinics. We've just been informed, as I mentioned a few minutes ago, that the federal government is going to start distributing further doses based on how many a state is reporting administered. And if the hospitals will not give us the data on how much they're giving out, it's going to start costing us doses of the vaccine. We need to get this right, and we need to get this right fast. I want to share a few other pieces of news. I signed 2 additional executive orders within the last 24 hours. Number 1, we are going to lower state flags in honor of the United States Capitol Police officers who lost their lives last week. And I've signed another to adjust the unemployment benefits to take advantage of the federal legislation that recently passed to support our small business owners. The 2 adjustments will be that we are going to waive the waiting period for those who lose their job due to COVID, and we're going to ensure that small businesses do not have to pay into the Unemployment Trust Fund for fraudulent claims. I also want to note that our current executive order is set to expire at the end of this week. I would anticipate, and we'll make final confirmation of this as we move towards the end of this week, that we will extend the order in substantial form as it currently exists, and we will do as we have been doing to adjust the counties with respect to the mask mandates based on what the data suggests and where we find ourselves in total numbers. Now, the last 2 days, and I'm going to turn it over to Dr. Dobbs and let him comment on this and other things. We appreciate his work. The last 2 days, we've actually saw a decline in the number of cases that are reported. That's good news. But I also want to be clear, 2 days does not make a trend. And in fact, even if that trend were to continue, I still expect not to see a decline in hospitalizations in the very short run, given that hospitalizations are a lagging indicator. If you look at the last 5 weeks, based upon date of onset of illness, the 2 weeks before Christmas, we had actually seen a downturn. We had rolled over in the total number of cases. The last 2 weeks, or basically the 2 weeks since Christmas, that has actually begun to tick back up. And because of that, I expect our hospitalizations, which have been relatively steady over the last week to 10 days, to remain relatively steady, albeit at very high levels, or increase slightly over the next coming days. My main priority is to not try to fight this pandemic with stricter and stricter guidelines or stricter and stricter orders. It's to get better and better at distributing the vaccine, recognizing that the virus is still before us, that we as individuals still must make good decisions. We can work to slow the spread of the virus, to minimize and to mitigate, and that is what our focus is. With that, I'm going to turn it over to Dr. Dobbs. Thank you very much for your work.
Thank you very much, Governor. Today we're reporting 1,648 cases, which is a decrease, but again, not clearly a trend. But sadly, we're reporting 98 deaths, the highest number of deaths that we've reported. Sadly, personally, I've lost a couple of friends and colleagues over the past week. And I think for those of you who really look at the old newspapers, I'll actually use the print version when I read the paper every morning. The obituaries are getting longer and longer, and that's likely to continue. As the governor mentioned, hospitalizations and deaths are going to trail no matter what. And probably about 3 weeks after a case is reported is going to be the risk of death. That seems to drive our hospitalization and death. So we're sad to think that we're going to see a lot more, especially as we're going into an era when we have a highly effective preventive measure. So please, be patient, do the safe things a little bit longer. We're almost, we can see the finish line. I'm not saying we're there. We got a little ways to go until we can get enough folks vaccinated, but we do have a way out of this. So please continue to wear your mask in public, and please avoid non-essential social gatherings. These are the things that are going to keep us safe until we can get a little bit further down the road. We've made phenomenal progress in the past week on our vaccination efforts. Very, very proud to see that. We have seen something that's not encouraging. Only 16% of the vaccine is going to African Americans so far. Last week it was 18% when we brought attention to this, and now it's worse. So we need to do a better job about making sure that we address the concerns about the African American community about getting the vaccine, and also about making sure there's access. And so that's something we're going to spend a lot of effort, and something the governor and I were talking about earlier today. If we look at our partnerships, just for awareness, last week we did give out quite a bit of vaccine to our partners in addition to our drive-through clinics. Last week to private clinics, we gave 9,100 doses of vaccine. To community health centers, we gave 4,600 doses. To hospitals, we gave 30,475 doses. And we had a small amount to pharmacies, which are eligible to be providers through our system. We gave 700 doses of vaccine to be shared with the public, according to the need. We'll continue to have our drive-through locations at Adams, DeSoto, Forest, Harrison, Jackson, Jones, Lafayette, Lauderdale, Lee, LaFleur, Lowndes, Madison, Neshoba, Oktibbeha, Panola, Pike, Rankin, and Washington counties. And I'd like to thank the National Guard and MEMA for their phenomenal help getting these things operational and rapidly successful. The other thing, as far as who is eligible for vaccine right now, as the governor mentioned, people 65 and older are eligible to sign up for vaccine in Mississippi, and those who have chronic medical conditions. And we've had questions about what those conditions might be. And so the conditions that are outlined by CDC are going to be what we've outlined in our scheduler, which is cancer, chronic kidney disease, chronic obstructive pulmonary disease, or COPD, Down syndrome, heart disease, immunocompromised conditions, obesity, pregnancy, sickle cell disease, smoking, diabetes. But also, if your physician thinks that you have other medical conditions that are serious enough to warrant a vaccine because of elevated risk, that also can suffice. So please, if you don't have one of these conditions and you think you might qualify, please get clearance from your physician. And Governor, that's all I have to offer at this time. Thank you.
Thank you, Dr. Dobbs. Appreciate you and your team, as always. At this time, I will turn it over to Colonel Michelle, who's going to give us some updates as well.
Thank you, Governor. Appreciate it. Good afternoon, everyone. I'd just like to start off, just go back over the appointment process real quick. You heard the Governor talk about how you will make appointments on that. So I want to manage expectations a little bit there if I can. Those of you that are calling in the call center are probably finding that your wait times are varying depending on when you call through. The wait times at the very beginning of this were 2 hours and up at times. I know that's very frustrating for those of you calling in. We have added to the call center and modified that and greatly reduced call times. We did have another surge the other day with some call times. We added appointments, but we're working to extend that. 3 ways you can register for your appointments. One of the things is if you can and you have access to go online, please use the online registration process. That is going to be the quickest and the most efficient way for you to do it. If you have an elderly person that falls into the 75-year-old or older category, or the 65-year-old, your parents or your grandparents, please help them, if you will, and get their appointments registered. Otherwise, certainly use the call center. We're going to be expanding that call center over the course of the next few days. That will reduce the abandonment rate on calls. It'll also reduce your wait time. That number for that call center, again, is 1-877-978-6453. And to go back again, the website is covidvaccine.umc.edu. Now, those 2 registration vehicles are only for your drive-through vaccination sites. If you're making an appointment at a hospital or a clinic, you'll need to make those directly with them. And you can go to the MEMA website or Mississippi Department of Health's website and get a list of eligible health clinics for getting your vaccinations. So the next thing I'd like to talk about just real quickly is going to move to Zeta real quick. As you know, we got a declaration for Hurricane Zeta. And we did open registration intake centers. They opened today at 8 o'clock this morning. They will be operational from 8 until 6 p.m. Monday through Friday. And then they will be operational on Saturday from 8 until 12 noon. They will be closed on Sunday to reset and operate again. We don't know what the duration of these intake centers will be, but we're going to operate them as long as we need to make it available. Those intake centers are available in George County, Greene County, Hancock County, Harrison County, Stone County, and then Jackson County Board approved theirs today, so theirs will be opening as well. And you can get those exact locations and addresses at the MEMA website at www.msema.org there. Reminder just to make sure the things to bring: Social Security number, contact information that you have, financial information for household income, any damage information to your house, insurance information, and any banking information that we might need to assist there. So, sir, that concludes my update.
Thank you. Appreciate that, Colonel Michelle. One of the things that we talked about last week is, from a logistics standpoint, working with our emergency management team to get a number of state-run clinics up and operational in partnership with the Department of Health, MEMA, and quite frankly, because of the personnel and the dedication of the men and women of the Mississippi National Guard, we were successful in getting those 18 of them operational in general. They open at different days. As I mentioned last week, we doubled the total capacity. We will be up to 30,000 appointments towards the end of this week, and I have instructed them to look for other ways to increase that capacity even further, perhaps even 30 to 50% more over the next 10 days. At this time, I'd like to turn it over to General Boyles. General Boyles has been out and about and thanking his men and women who are performing this, and I'd like to have him talk a little bit about it.
Well, Governor, thank you, and I appreciate the opportunity to say a few words about the really the young men and women who are out there doing some really important work for the state of Mississippi. Yesterday we were in freezing temperatures, and the governor said, let's get after it. And so, we put on the uniform, pulled up our socks, and we were out there giving vaccinations at 12 locations yesterday. I toured around a little bit and saw there were a lot of customers in line. I will tell you that it is a long wait. Please be patient with us. We want to get a vaccination at every arm that we can at these sites. Currently, we're running at about 400, Governor, as you know, 12 sites a day. We have the personnel to cover down on those sites. We also have the personnel to continue doing the testing as requested by the health department. And so we're prepared to react on all those, Governor. I will also say we're working with the governor's office and the governor to expand those sites, to take in more capacity. And I know that the governor will make some decisions along those lines, and we'll be prepared to support whatever he decides.